Good evening to all of you there. The Association of Pakistani-Descent Physicians Society. It's a pleasure to address your annual meeting and to all of you. I'm very glad that Pakistani physicians are trying to bring a change within your abilities to try and help Pakistan in every which way, including while you are working in the United States of America. Your linkages to Pakistan and to your alumni association, alumnus institutions is very important. Over the years, over the last few decades, we have seen tremendous work done by Pakistani physicians who are settled in the US while they've been bringing in philanthropic money into their alumnus, improving those institutions and delivering healthcare, as well as collaborating as in education is concerned. Pakistan is faced with a number of situations. We went through COVID very well. In fact, we managed COVID better than a lot of countries in the world, and we didn't come to a total lockdown. We had relatively much less casualties, and we learned a lot in considering creating a balance between our economy, the fact that we cannot afford a total lockdown, and prevention. The polio efforts, our experience in polio vaccination help us in doing this also. At the same time, we kept open our mosques. I think Pakistan was the leader in the world that with social distancing we kept open our mosques, and the Muslim world learned from us also. Having that experience in the background, today we are affected by floods, and tomorrow also I am going to visit Dadu and Nawabshah districts, and I visited other areas, just taken a tour just to see what is happening and how can the government come in and help. These are natural disasters which are beyond a government to handle, and therefore Pakistan has been sending out an appeal to all those, especially Pakistanis like you, to all those who can help to reduce the suffering of the people. This is a natural disaster, more so related to global warming. But there are few particular issues which I would like to highlight before you. And these particular issues are related to what you can do. Going beyond the flood situation, what is a constant effort which you can make. Let me take pride in the fact that you have helped medical colleges and hospitals in Pakistan. Let me ask you to continue with that, bringing sophisticated technology. Let me ask you to continue with that. But at the same time, I would like you to try and improve the education standards. A number of you are teaching in the US. A number of you have tremendous experience. And while I was doing my master's in Michigan in 75 and then in 84 from San Francisco, I believed then that the available recording methodology of those days when you could bring a lecture down to a videotape and a procedure down to a videotape, things have progressed tremendously more. So if our graduates can actually see the processes being done in the US hospitals and the processes being carried out and the lectures being delivered, I think that will be a tremendous boost to education, a real-time situation. So I think those efforts can be increased further. The other thing is the ability of telehealth to be able to reach out to the people, the poor man. He should pick up a phone and be able to give a call to somebody to get immediate advice. That we can do among friends, for example. Even if I'm not a doctor, in our middle class or the upper class, we can always pick up the phone and get advice on a stomachache or a headache or some disease process. But what happens to the poor man? He postpones things and things get worse. Fourth thing, probably, which we should be talking about is prevention. Pakistan cannot cure diseases, but Pakistan can prevent. The fact that there's stress in society, and the research has shown that there are 24% people at a single time, is a very alarming issue, considering the fact that we have only about less than 2,000 psychiatrists and psychologists, trained psychiatrists and psychologists. So Pakistan has a shortage of manpower. Imagine the loss of all of you. When Pakistan could not accommodate you, we educated you, got your education here and then you went abroad. So that's a loss as far as I'm concerned. And that is what you also feel the same. because then things get settled down and you get stuck, although many of you wanted to come back to Pakistan. So there has been a brain drain, but at the same time we lack numbers in our healthcare institutes in a number of ways. So having suggested a number of areas for you to take part and satisfy your patriotism, satisfy the fact that you have a link with Pakistan, and it's something which is desperately needed. We need your help more. Of course, you do it with money, but we need more of your intellectual help. So with these wishes, I must thank you to bring about collaboration between the governments of Pakistan, trying to sort out a permanent solution for the accreditation of Pakistani institutions by World Federation for Medical Education. I think that's a good effort that will make it easier for communication and movement of people between different countries. But we lack manpower and we lack intellectual resources. Thank you very much.
Thank you, Honorable President. I just wanted to say that we have 2 more segments, and we will have dinner, and then we'll have Mr. Anwar Maqsood and music. So there's lots of entertainment. Just be patient and bear with us, and thank you so much for being an amazing audience. I've never seen an audience like that is so humble and so patient. So thank you for doing that. I would like to invite Dr. Tariq Butt to introduce the keynote speaker. Dr. Butt.
So good evening again, and we are very, very honored to have one of our own, Dr. Rafat Ansari, as keynote speaker and also very special guest tonight. And his lovely bride, Zorain, has been our classmate with Rizwana and myself. So can you stand up, because you made him a lot of things too. So let's give her a round of applause too. And then I just wanted to say that this wonderful couple has done wonderful things. And so, but today I'll focus on one part, Dr. Rafat Ansari. And he is a great physician. He got his medical education from one of the finest, and there are many graduates from Liaquat Medical University. And then after that, he did his residency at Weiss Memorial in Internal Medicine and Indiana University Fellowship in Hematology Oncology. But I really was looking at, what his passion is about cancer patients. Cancer patients, in his own words, really need a very focused, specialized, compassionate care. It's not easy to provide them that level of comfort when they're dealing with such a deadly disease. And I think his compassionate love for patients and patient care has made him a lot of things, and he achieved and got a lot of awards. And most important thing, like Michiana Medical Group, which he chairs for a number of years, and he has many of his colleagues. His brother Aftab Ansari is here too. And I'm thankful to their dad, because when I was a medical student, I broke my femur and he fixed my femur. And so, I'm standing here because, I could still have a good, strong femur. So, thank you for that. And I really want to get your attention on what they did really was remarkable. It was a gift of $15 million they gave to one of the most prestigious institutions, Notre Dame, Indiana University, which is a Catholic university. And what is going on in the world right now? We have a lot of conflicts, and we don't know how to resolve it. And we have a lot of these faith and beliefs which may not agree with each other. But we have to really figure out a way how to pull people together rather than divide them. So that's what they have done. This huge gift they gave to Notre Dame University has created Zorain and Rafat Ansari Institute on global religious engagement. And since 2017, so give them a round of applause for doing that big gift which will last forever. And because of that gift, there's more religious harmony and continued dialogue. which I cannot tell you, but he'll tell you. At the same time, I would like him to come to the podium and express his views about that one and only Rafat Ansari. Let's give him a round. Welcome.
Well, one and the only was very good. Thank you. So, good evening and assalamu alaikum. So, me and my wife are very thankful to this group that you invited us. This is a really esteemed group that we are addressing. So, I am by profession a physician and I'm an oncologist. I will talk about maybe a minute or two about my practice, and then I will concentrate more on our philanthropic activities. So when I started 42 years ago, a practice in South Bend, Indiana, a small town where there wasn't any consultant, especially a consultant of a brown color and a Muslim. But I stuck around there, and I think that was one part of my success was that I never